the representative of the National Center for Public Policy Research. You have the floor.
Okay, thank you. I'm Jeff Stier from the National Center for Public Policy Research. I thank the chair and the entire panel for allowing the comments. I've been very heartened to hear that there is a consensus both on this panel and in the opening session that there is a need for all parties to have a seat at the table, not only governments and NGOs, which I represent, but industry itself. We can't solve the problem of NCDs without engagement from industry. And I'm hopeful that there is almost a change of perspective here, that industry should not be seen as the cause of public health problems as it has been in the past, because we didn't solve problems that way. But if we see industry as a potential partner in a regulated environment to help solve problems, I think we could actually do some good. I would encourage the UN high-level meetings outcome document to include specific examples of how the private sector can and be engaged to fight NCDs. I see two particular examples in two of the big areas. Number one is food, and number two is tobacco. On food, we should encourage the use of food technology to do things like lower salt content in foods, encourage the safe use of artificial sweeteners to help lower sugar consumption, so that people can improve their quality of life and have high quality of life, make the decisions that individuals want while still protecting public health. And that's an area where the private sector with government partnership and leadership can actually do some good to fight NCDs. And the number one preventable cause of death in so many countries is tobacco. And I think that's an excellent example of where we've seen the private sector, demonized as they have been in the past, appropriately so, now beginning to offer innovation and technologies that can help reduce the toll of tobacco-related disease. And we've seen just over the past few years, e-cigarettes have done so much good for so many smokers who have been trying to quit tobacco use. And while no form of nicotine is safe or should be encouraged, it is harm reduction is a standard public health approach. And I encourage the committee to consider tobacco harm reduction, the use of non-tobacco products, including e-cigarettes, to lower the risk of disease. And that's the way that the private sector and the governments can work together to reduce NCDs. Thank you for your time.
I thank you. You know, when we speak about multi-stakeholder, it really is going to mean all of us working together. And I hear you loud and clear. We cannot look at industry as the enemy per se. We have to look at it as a partner. And you're proposing that we do this within a regulated environment, and that has to be how I think we approach it. We can't just say, well, you know, you are against my interests. All of us have to come together and be able to work collectively. So I very much appreciate those comments. I have several requests for the floor.